Hello, I'm Dr. Alfred Song. I'm the Director of Medical Services and a Senior Medical Officer here at Tully Hospital.
Hello, I'm Vicky Harrigan, the Director of Nursing, Midwifery and Facility Manager of Tully Hospital. Tully Township is made up predominantly of agriculture, namely bananas, sugarcane, cattle and tropical fruits, and this is the community that we serve.
Tully Hospital is a Level 2 hospital and we provide care through our emergency department, inpatient ward as well as outpatient GP clinics. We are also serviced by visiting clinicians and physicians, and if you're training to be a rural generalist, whether you're a doctor, a nurse or allied health, Tully is a great place to be, and let our team tell you more about it.
I came to Tully Hospital in 2020 and I was only meant to come in for 3 months as a relieving doctor. 3.5 years later, I'm still here. Tully Hospital have come a long way. Used to be the community of almost up to 5,000, looked after by one doctor and being on call every day. So from that situation more than 10 years ago until now, we have up to 9 doctors, 5 seniors and 4 juniors. We have Director of Medical Services, Dr. Alfred, who really supports us.
One of the best things in this hospital is that we are such a tight-knit community and we work really well together. The teamwork is exceptional here.
As very young medical students who've not had much exposure to the clinical side of medicine, Tully has been a wonderful change to that.
Yeah.
The whole team, not just the doctors, the nurse, the allied health, have really made it a nurturing environment. I feel like we both are comfortable enough to speak up and say we don't know something and not be embarrassed or ashamed. They facilitate a very positive and learning environment.
I moved from Sunshine Coast 3 months ago to be the nurse unit manager for Tully Hospital, and now I'm thinking why I wasn't here earlier. We are a small facility yet with a busy emergency department and an acute medical ward, or we also provide primary health care through GP clinics.
My name's Amber. I'm a PGY2 resident from Cairns Hospital. So I've come here as a resident, mainly GP role. So I do a bit of ward and ED, but a lot of the time I'm in the clinic here in the GP practice. The GP clinic is really a fun place to work because the clinic's actually part of the hospital. So a lot of the time I'll see a patient on the ward or an ED and I'll actually follow them up in a few days' time in the clinic. So I know their background already and it's good continuity of care.
I'm the only physio here at Tully Hospital, together with our allied health staff. We cover the wards, outpatients and emergency department as well. Today my littlest one is a 2-month-old baby and the oldest one I'll see is a 91-year-old lady. So we see a bit of everything, which is really cool to learn.
I've grown as a diagnostician. Working in Tully Hospital, I've had to think a lot more than I've had to in the past. One of the biggest challenges is the logistics of everyone who comes in who needs an investigation. Just because they've come to a rural center that doesn't have that investigation doesn't mean that they shouldn't get it. And the logistics of just even organizing a CT abdomen and trying to figure out the either road transfer or air transfer and talking to all the relevant people. Being able to do that is very challenging, but it's also very rewarding. And the staff here are incredibly supportive at helping you reach those decisions.
We are such a small facility, so the services are limited. So on top of our duty, some of the nurses also do X-rays, which can be quite challenging at times, but it's something that needs to be done for the community.
The biggest thing that I struggle with medicine is creativity. And I think the more rural that you go helps you to be more creative because you haven't got much resources. So you have to always think about what is the safest thing to do for a patient given the resources that you've got. And I think places like Tully is great because you can be a bit more autonomous and a bit more independent with your clinical practice.
You can pretty much experience anything. Yeah, it can be anything from GP-related presentation to full-blown big emergencies, and so there is quite a wide area of knowledge to gain here.
It's pretty difficult to find another spot in Australia that's as good as the Cassowary Coast and Tully and Mission Beach.
The lifestyle is one of the things that encouraged us to come up here. Our weekends are always normally pretty busy, so we like going out to the reef, diving, spearfishing, fishing, snorkeling around.
We've got so much local produce around that if you really challenge yourself, you can find just about everything you need in the area. I really love that challenge of being able to forage your own stuff and create some great meals and decrease your carbon footprint and live in a beautiful area. I've moved to Mission Beach. The place is beautiful and I always had a dream of owning a boat. So 2 dreams, one was to become a doctor, The other one was the boat.
There's lots of walks, there's the beach, there's the reef, there's lots of waterfalls and waterholes. Really lovely place to work actually.
Yeah, it is. Yeah. Also some, like a really nice community culture with the coffee shops and community markets and all sorts of things.
So for nurses who are looking for a variety of experience, including acute experience, this is the best place to work.
I like being a rural doctor. It's a lot of, satisfaction. And I think Tully is a really good place to work.
All right, so you've heard from our team. If you have any questions, please feel free to get in touch. And we hope to see you at Tully Hospital very soon.
You're all very welcome.